Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Stephen Foster, and he is the Director of the Office of Digital Health and the Department of Family and Preventable Medicine. That's a mouthful. Dr. Foster, thanks for being here today.
Thank you so much for having me.
So we've seen rapid growth in consumer health technologies like smartwatches and even home diagnostics. What's driving the surge right now?
I think the biggest driving force is patients like knowing what's going on. There's become this big interest in overall health. You've seen that with the massive explosion of the wellness industry recently, but it's also giving patients control back. That and a lot of the devices, especially the Apple Watch and the Google Watches, specifically deploy gamification. You set the watch up, you track your steps, you have competitions with your friends and family, and it really helps promote that aspect that people enjoy.
So from a clinical perspective, how would you define the role of wearables in today's healthcare landscape?
It's complex. I think the biggest thing that we struggle with is everything has a purpose, but do we understand what its purpose truly is? So utilizing consumer grade resources like your Apple Watch or your Fitbits or those technologies are great, but it doesn't necessarily translate over to the medical side. Mm-hmm. And on the other side, the medical grade devices like your continuous glucose monitors, your scales and blood pressure cuffs that have been integrated and validated have a much bigger role in making those adjustments. And I think it's a combination of what's going on. Mm-hmm.
And are we truly shifting from reactive care to proactive? Are you seeing data-driven care? And how is that really a shift here in Arkansas?
It's starting to happen. We've really expanded that in my primary care practice to where we really started pushing blood pressure monitoring from the clinic back to the home. So when patients come in, your blood pressure is elevated or above goal, we usually talk about getting a blood pressure cuff, getting it calibrated, and then we work on actually tracking at home. So either you upload the data directly to the patient portal, or you send us either whatever communication style you use to send us the information back, and we track and make decisions based on how your blood pressure is at home, not necessarily in clinic.
So devices like the Apple Watch, the Oura Ring can now detect things like irregular heart rhythms, even sleep disturbances. How reliable is that for your practice?
So it's a great information point to know. I think for making clinical decisions, we're not quite there in a lot of those commercial devices. And I think the struggle that we have is that the risk of these things like atrial fibrillation or sleep apnea really are determined on a lot of other external factors. So because you have an alert from AFib and you're 20 does not mean the same thing as having an alert for atrial fibrillation or that irregular heartbeat when you're 70. Those populations are different, but inside the Apple Watch, they can't really discriminate that as well.
So what kinds of conditions are most realistically being detected earlier because of these types of devices?
So we do get foresight into irregularities in heartbeat. So we don't look at individual notifications, but we can look at trends. So if you come in and you're like, hey, my Apple Watch is telling me my heart rate has been elevated, we can look at trends and be like, hey, there must be something going on, and then pursue that as additional workup to get ahead of it. I think as far as devices we're actually using to make a lot of medical decisions, those for the most part are still the medical grade versions.
So where should clinicians be cautious about over relying on patient generated data?
I think the cautious aspect comes from understanding where and how the data was collected. And going back to your Apple Watch, Apple Watch data is really dependent on, is it being worn in the right location? Is there good contact between the skin and the device itself? Are there any external factors like sweat, dirt, or other things that go on the skin that may be causing issues with readings?
So how do you balance the promise of early detection with the risk of false positives? And how does that connect to patient anxiety?
So we've seen both ways. I've really had patients that will use their remote devices as the source of truth. And we always have them come in and go, look, you're getting these readings at home. Let's have you come into clinic and let's make sure those are right. And that's been a good resource to use, especially for blood pressure monitoring. Mm-hmm. The one thing we do is we will have you come into clinic and we'll validate your blood pressure cuff, because we've had brand new blood pressure cuffs fresh off the shelf that have had a 20-point difference in the top number that have been the difference between adjusting blood pressures or increasing blood pressures and leaving them the same.
Mm-hmm. So how are primary care providers integrating this influx of patient-generated data into busy workflows? Is it changing?
I don't think we're doing it yet, but it's definitely coming probably in the next 5 to 10 years. I think the big thing that we're going to struggle with in primary care is now we have too much data. How do we know what to do with it? And that's been the biggest barrier right now, is just because you can get a data point like a heart rate at home, when you start sharing that data, especially electronically with electronic health records or with your physician, there's a lot of data points to go through. And what happens if something is missed inside of that data?
So what does this mean for rural healthcare access? Is that something where traditional monitoring may be limited, and how does that change?
So in the last couple of years, remote patient monitoring has actually been a really big push on the outpatient world. And so we've got a lot of new workflows through Medicare and other payers that will allow us to actually start utilizing those codes and actually, one, being able to utilize them, but two, also being able to bill for them to help make sure that data is being used. And so we do that right now especially with continuous glucose monitors, to where I can call you at home now and go, hey, I've been watching your blood glucose. I checked in, logged in today. You're doing much better, or hey, something's going on. Let's adjust your medication. I don't need you to come see me. I don't need you to spend an hour, 2 hours, sometimes 3 hours in my office, when I can either I can or one of my staff members can make a call and adjust those medications while you're at home.
So we're seeing, or are you seeing measurable improvements in outcomes for things like that?
So we have, and from both the patient satisfaction, patients really enjoy not having to come in and see me every week or every month, but also from patients getting to maintain control. Especially with blood glucose monitoring, they can now see how their diet affects their blood sugar. We've had patients where I can tell every time they've had broccoli because their blood sugar goes up by 30 points. I would never have caught that as anything going on, but I've had them bring broccoli into clinic one day, they ate it, and I could track during the clinic visit that their blood sugar went up.
And what are the biggest barriers to integrating wearable data into clinical decisions? Is it technology? Is it reimbursement? Is it trust?
It's a combination. One of the biggest barriers I have right now is how to get the data from your device back into our electronic health records. We can access it when you give it to us. We can go to another website and sometimes access data there, but that also creates a barrier to us actually being able to ingest and use that data. The payer side of it and getting reimbursement has gotten much better recently, but with that also comes the burden of cost sharing. Just because we can get reimbursement for something doesn't mean that cost doesn't shift. And so it may mean that instead of a $20, $25 copay, that you have a $2 fee, but still that may be surprising to some people that aren't necessarily expecting it.
And how should healthcare systems think about data overload and liability when patients bring in this continuous stream of data?
That has been the big question from the national level, is the more data you ingest, the better information you can sometimes make. But at the same time, too much data can sometimes hide fluctuations going on. And there's still a lot of decisions and a lot of work being happening in that area, especially with institutions that are much more remote patient monitoring heavy, of how much data, how frequently, and when do they collect it. So we may not know every heart rate, every heartbeat that you have the entire way through your entire day, but we may choose to collect a pulse measurement or heart rate measurement once every 15 minutes.
So what excites you most about the next generation of at-home diagnostics?
I think the thing that actually excites me the most is letting patients not have to come into the doctor's office as much, especially as sleep apnea studies convert to home sleep apnea studies, which is the big one now. There are some new AI-assisted devices out there that you can actually go to sleep wearing a ring, wake up the next morning, and we can tell you whether or not you have sleep apnea. So you no longer have to come to a sleep clinic, get connected to a bunch of wires, not get any rest at night, and wonder why you have sleep problems.
And do you see a future where early detection through wearables significantly reduces hospitalizations or even emergency visits?
I think so. I think especially when it comes to things like heart failure, those are great opportunities where we've actually seen really good data now of being able to monitor somebody at home means that we can intervene sooner. We can call you, we can adjust medications, we know what your weight is doing, and we have alerts set up in our EHR that will go, hey, Stephen Foster's weight increased this today. We need to call him to see if there's something going on that we need to adjust.
What guardrails are needed to be in place to ensure equity so this doesn't widen the gaps in healthcare?
I think that is going to be the big question, because a lot of these devices aren't cheap. Even the consumer devices like Apple Watches aren't cheap. Not every insurer is going to cover every device. And I think that's going to be the struggle of not only can you afford the device, can you afford the costs that are run with us monitoring the device? But also, how is that data going to get back? Some places in Arkansas don't have access to broadband internet. Some places in Arkansas don't have cellular connectivity. And so you could have all the data in the world, but if there's no way to get it back to us, that disparity is going to remain.
So if you could give one piece of advice to healthcare leaders in Arkansas about just preparing for this shift, what would it be?
I think the best thing for physicians in the workforce is learn the devices that are out there and their strengths and weaknesses, and make sure you're educating your patients on when and how is the appropriate time to use them.
Well, Dr. Foster, thank you for talking about this important information and what's ahead for healthcare. I appreciate you being here today.
I appreciate you. Thank you for having me.
And that's it for this episode of AFMC TV. Have a great day. Thanks for watching.